Well, welcome back to Your Carolina. We've got a great segment courtesy of Carolina Plastic Surgery. I want to introduce you to our guest, Dr. John Lettieri, MD, plastic surgeon from Carolina Plastic Surgery.
Morning.
Thanks for joining us.
Thank you.
Well, we have got a great, you're doing a fun series with us for the next couple of weeks, so we're so excited to have you. And this series, we're going to be talking about some common misconceptions of breast implants.
Right.
And apparently there's some new cohesive gel plans that's out there now.
Yeah. So one of the misconceptions is that implants have to be changed every 10 years or at any particular number of years. And in fact, with the new devices, they can last much longer. And I think one of the devices we're going to talk about is the cohesive gel device.
It is every few, I won't even say few years, but throughout the years we've seen breast implants really change from silicone to you don't want silicone to all of a sudden there's nothing wrong with silicone.
Right, yeah. So that's part of the reason for having this discussion. There's a lot of misconceptions about that. And saline implants are still used, but for a while they were the only ones available.
Right.
Now we have a couple of silicone choices, both the cohesive gel and the kind of the regular silicone implant, and women are probably opting for those more commonly now than saline.
So you have the two most popular here,
right?
Right.
Right.
Tell us how they would be referred to. I know. Yeah. I think I know what one of them is referred to as.
This one is often called the Gummy Bear Implant, just because it has that kind of consistency. If you have kids and you've ever had Gummy Bear, well, that's kind of the feel of it. It holds a shape. So for women who like a very natural shape, a teardrop shape, and it's very natural.
Even more than have I ever had gummy bears, we've actually had breasts, so I would be interested to see if it feels like a real
right.
And it does, but there is a shape to it, and that's what we're showing.
So for women who like that particular look, or for women having breast reconstruction, particularly where the implant really is going to be their shape, a teardrop shape is going to look most natural.
For those who go, yeah, but what if this twists inside your body? Please explain what this is made of on the outside.
So it's textured, Kimberly. That's a good point. Whereas this is the more standard silicone implant. It's smooth.
Okay.
It's round. It doesn't have as much of a teardrop shape.
And if it moves inside your body, it doesn't matter.
Doesn't really matter.
So does it move? It's not actually moving like that.
Right. Textured implant, the texturing helps make it stable, and that keeps it from moving, and we've really never had a problem with that.
All right, and they both, I have to say, you know, as a woman, they both feel very natural.
So that's what most women feel as compared to the saline implant, which is okay. It's a water-filled device, but obviously water's not going to have the same consistency.
Right.
And are they heavy? Like, do they feel heavy?
You know, they're about the same weight as that much body tissue would be. So they weigh about the same as if that was the woman's natural breast.
Do either of these have a longer shelf life? I say shelf life. You being the shelf.
Yeah. Probably the cohesive gel. I think around the world, and again, there's only a few of us around the country that can use all of these implants. We're fortunate to be one of them. And that implant probably is the most durable. So that's why I say 10 years is definitely not the standard any longer. And even with this one, it could be much more than 10 years. Saline implants, the problem is that they're going to go flat. And it's unpredictable. It's not dangerous, but pretty distressing for a woman to have a deflated implant.
Right.
Now, tell me some of the ages, you know, that you need to be if I wanted to come see you to get one of these.
So interesting. That implant is available for women starting at age 18. There's not really much science behind that. It was more that the group of women that was looked at to get the implants approved, the youngest was 18. With this implant, it's 22. With saline implants, it's also 18. So starting at that age and right on up, you know, women
Does the manufacturer come up with the age difference?
Not really. It's looked at by the FDA, and they just look at the group of women that were part of the original studies. And they take the youngest woman, and if that was 18, which it was, then they're good for...
And that one's okay for 18. There are, of course, many reasons as to why a woman would consider getting breast implants, and it is not for everyone, but everything from reconstruction, from women who have gone through breast cancer and want to try and get back to what they remember, to a mom who wants to get back to what she remembers.
We all know they don't look the same after having kids.
So the so-called mommy makeover, kind of a popular term, often includes some type of breast rejuvenation, maybe a lift, maybe implants and a lift, and tummy tuck is the classic description. But yeah, sure, middle-aged women, older women, we're seeing an increasing number of older women, older than the average from from history that are having implants replaced because they've had their original implants back in the 70s, 80s, even early 90s.
So much better technology available now. How can people get in touch with you? Because you've brought up a lot of great points, and they might have more questions for you. I know we've got some of the stuff on the screen, but real quick, what are you close to in Spartanburg?
Carolina Plastic Surgery. Our number is 583-1222. Our web address is just drlettieri.com. Lots of good information there. So we're happy to field questions.
And you kind of brought up, the mommy makeover, and we want you to kind of stay tuned because next week we're going to talk more about if you can, have a surgery like this while maybe doing another procedure.
That's right.
As well. So to catch that out June 22nd, I believe we'll be back.
That's right.
So look forward to that.
Thank you so much.
Thank you for having me.
Answering some questions we all want. You wondered,
right?
That's right.